Substance use disorder is a medical condition that involves recurrent use of drugs, alcohol, and other substances in a way that creates significant distress or impairment. It impacts the person's brain and behaviors, leading to that inability to control their substance use. Recovery is that process of change where individuals are able to improve their health and wellness, live self-directed lives, and strive to reach their full potential. And our goal in family treatment is to increase a client's connection with their health, their home, their purpose, and their community, as we know that's going to decrease that problematic substance use, increase their mental health, and improve both outcomes for that client and mom and their family. Healthcare providers need to understand that substance use disorder is not simply a matter of choice or lack of willpower. It's a complex medical condition that's often intertwined with underlying physical and psychological and social factors. We want to make sure that we're including their families in all aspects of their treatment plans and creating an environment that develops trust and welcomes families. Family treatment is vital in helping to support mothers during pregnancy and throughout postpartum, and navigating that family dynamic and supporting all of the members of that family system is key to reducing that impact of future generations. As providers, we have to explore a client's willingness, ability, and motivation for making a change in their use. Providers need to be able to establish that non-judgmental and trusting environment and be able to assess not just for substance use, but for mental health, connecting with those individuals on a personal level and making appropriate referrals for services, and also to follow up to see if they engaged in those services. We also want healthcare providers to consider medication-assisted treatment, being able to engage family members in support systems. Family-based treatment involves children, and there's limited services where moms can bring their child to treatment for substance use or mental health. We have a fully licensed daycare here where moms are able to focus on their recovery in a way that they know that their kiddo is still connected and unified with them. In family treatment, we see better outcomes, not just for mom, but we see better outcomes for child. We know that the mom is identified client in family treatment, and we really want to make sure that the kiddo is also getting services. Occupational therapy, speech therapy, early learning support, diagnostic assessments for children, and really create a treatment plan around that child. One thing that I would change is funding for family services. We need to create more spaces across the continuum, especially mothers postpartum. Right now we have a handful of services for substance use for mothers, and we have next to zero for fathers. We really need to make sure that we're providing support to all parents. Family treatment is prevention work. It impacts all areas of our legislative budget. If we invest in the care for families, we can have better outcomes, not just for the person with the substance use disorder, but by reducing risk for substance use in the next generations. It allows in a reduction of ACE scores, generational trauma, poverty, early death, and incarceration. We have an entire generation of parents that we've lost to the opiate crisis, and another generation of kids growing up without their parents. We need to focus on the family.